Hi, welcome to Physionic, where we learn the body from the macro to the micro. In this full-fledged exam and content, we will take a brief look at the data presented in 3 studies looking at vitamin D's role in mitigating severe symptoms from SARS-CoV-2 or COVID-19.
Learn your body, a science-based education.
This data is given to us by 2 retrospective studies and what I would consider a discussion of the current data. To access these studies, I will have them linked to this content for you. So we're on the same page. These studies are looking at associative data, meaning a cause and effect cannot be determined, but it might still offer some information with which to defend against COVID-19 symptoms. In the first study, they went back and looked at the known average concentration of calcitriol, which is metabolized vitamin D, across several European countries and compared those average blood vitamin D numbers to 1, overall cases of coronavirus infection, and 2, death rate from coronavirus. So, what did they find? Well, they found a moderate negative association for both outcomes, be it infection or death rate. This means that as blood vitamin D levels increased, COVID-19 infection and death decreased across 20 countries. Said differently, the less vitamin D in the bloodstream, the more likely one was to be infected and more likely to die. Again, though, because there are innumerable amount of potential confounding variables, it is impossible to say if vitamin D is actually protecting against the coronavirus. But if we look at the other 2 papers, we might get a bit more clarity. Second paper isn't so much offering much data, and it is looking at the death rate in people who are infected across the United States and comparing that to the latitude on the Earth. The idea being that in northern states, people don't get out as much or as often because, well, it's colder. However, southern states typically experience more outside time, more exposure to the sun, and therefore more vitamin D synthesis by the skin. They end up determining that the latitude matters, and the closer to the equator one is, the less likely one is to die from COVID-19 across a multitude of states on average. Unfortunately, I didn't actually see any statistics run on this data, but they say it's substantiated by other literature as well. I'd venture to say this is weak evidence, but it fits in with the overall picture, especially with this next study. In this final study, the researchers took data from hospitals and stratified patients with COVID-19 into 4 groups based on preset criteria for severity of symptoms. Mild, symptoms without pneumonia; ordinary, symptoms with confirmed pneumonia and fever; severe, which is hypoxic, meaning patient's blood was low in oxygen, indicating poor lung function; and critical or intensive care respiratory failure. Then the researchers had 3 levels of vitamin D in the blood. 1, normal at 30 nanograms per milliliter or higher. 2, insufficient at 21 to 29 nanograms per milliliter. And 3, which is deficient at anything below 21 nanograms per milliliter. All the COVID-19 cases had their blood tested several times over the course of their stay at the hospital. So what did they show when they cross-compared disease severity with vitamin D levels? Interestingly, mild symptoms were in the normal vitamin D range. Ordinary and severe symptomatic individuals were in the insufficient range for blood vitamin D, and finally, the critical symptomatic patients were deficient in vitamin D. So the less vitamin D circulating in the bloodstream, the more severe the COVID-19 symptoms. So what conclusions can we make from all this data across the 3 papers? Regardless of the correlation seen across all 3 studies, it doesn't prove anything definitively. It is certainly positively suspicious that there is a trend of higher vitamin D levels in the blood are also tied to milder COVID-19 symptoms and less death. Could there be something there? Well, definitely, based on this data. I certainly would not say it is the only factor if it is a factor. However, maintaining normal levels of vitamin D is already known to be extremely helpful for maintaining healthy, functioning immune system. So it's not far-fetched to think that deficiencies in the vitamin lead to poor ability to fight off infection. Does this data imply that over-consuming vitamin D will help. Not at all. It merely implies that having normal vitamin D levels might be helpful at reducing your risk of severe infection or death. It is also entirely possible that something else that co-correlates with vitamin D in a direct manner could be the real contributor to an effect against COVID-19. But assuming that's not the case, which is a big dismissal, this data correlates a lack of vitamin D with a worse COVID-19 outcome. With that said, it certainly doesn't hurt to maintain the normal range of vitamin D, helping your body out overall, be it through supplementation or by sun exposure. So I hope this proved informative, and I hope to have the absolute pleasure of speaking with you in the future.